Hello, everybody. This is Joseph Alpert, editor-in-chief of the American Journal of Medicine. I'm here to call your attention to what I think was a very interesting article in this month's journal. It has to do with the antiphospholipid syndrome. Now, that's not too common, but what it is, I think the physicians will know. It's an abnormal antibody protein floating around in the blood that sets off the clotting cascade. And so people get little emboli, little blood clots flying around, and they're particularly bad when they go to the brain because those are very small end vessels and people have strokes. The answer is to aggressively anticoagulate these patients. Some information in the past suggested that the warfarin, our old anticoagulant, was more effective than the DOACs. There's going to be more studies on that because the DOACs, the direct oral anticoagulants, are so much easier to use. But in any case, this very interesting article looked at a whole bunch of patients with it, and they found that if you weren't in range with the warfarin, and that's the problem with warfarin, you have to be tested all the time. The people who weren't in range and who had more other illnesses, more comorbidities, did very poor. So again, that was what we saw in all of the warfarin versus the DOAC trials. The problem was the warfarin was, 15, 20% too high, 15, 20% too low. When those things happen, then the patients are at risk either for bleeding or for clotting, whereas the DOACs were constant in terms of anticoagulation. So I look forward to seeing more trials in these folks with the antiphospholipid syndrome. By the way, a lot of patients with lupus have this syndrome. They have the abnormal protein floating around. So thanks for tuning in to us. Stay in touch with us through all of our social media and through our website, and I'll be seeing you next month.